Good morning, doctor. Can you please introduce yourself?
Good morning. I'm Federico di Rocco. I'm a pediatric neurosurgeon at the Hôpital Femme, Mère, Enfant of Lyon in France.
How long have you been using Mectron surgery for?
I've been using the surgery for Mectron for the last 5 years since I moved to the Lyon University.
What made you change from traditional rotating and oscillating tools to surgery?
As a pediatric neurosurgeon, we are searching for tools which minimize the morbidity and the risk of damaging the neural structure or the dura. This tool allows to do the osteotomy with the minimal risk of damaging the underlying structures.
Which procedures are you using it for?
Usually for the bone cutting in the osteotomy for craniofacial surgeries, but also for the spinal procedure, for doing the laminotomies, for approaching intradural lesions.
After the adoption of surgery, have you changed the way you do some surgical procedures?
The way it changes, the use of this instrument is in the cut, but we can achieve to remove the bandeau, and also some osteotomies that we can do without doing burr holes.
Are there today surgeries you would not do without surgery?
All the manipulation of the bandeau is safer using instruments that may not damage the underlying structures. And for these reasons, the manipulation of the bandeau will be safer with this type of surgery instruments.
Thinking about your patients, which are the main intraoperative and postoperative advantages you have observed for them?
The osteotomy line is very thin, and the reossification is also very good. And these are advantages that are particularly useful in children and for all the craniofacial surgical procedures and for also the spinal procedures, which allow for a good reossification and stabilization.
In your opinion, is there any disadvantage in using surgery?
The main disadvantage is related to the fact that there is a learning curve, and as always, when we are trained with an instrument, it's difficult to change to another type of instrument with a different way of working. It is not classical osteotome, it's a different functioning, and so you have to learn how to use it.
Is total surgery time same, more or less, using surgery?
Overall duration might be increased at the beginning because the instruments needs to be mastered, but at a certain point the duration is not significantly higher.
Is there anything else you would like to add?
That is an instrument that is worthwhile trying and to learn how to use it.
Thank you, doctor, for your time.